I have been troubled recently by some of the claims I've heard about health insurance reform legislation that we've been working on here in the Senate. When I spoke out here on the floor earlier this July, I said that all you had to do was look at a newspaper or turn on cable news to see that the rhetoric on health insurance reform was heating up. Well, unfortunately, as is often the case, the debate hasn't gotten any better, but it certainly has gotten louder. Now, I know there is a lot of concern out there, and there's a lot of bad information going around. The latest outrageous claim about reform is that it would hurt America's seniors. Well, Mr. President, I'm here today to tell our seniors and their families that claim is false. And I want to make this perfectly clear. We are not proposing here in the Senate to cut Medicare benefits or do anything to negatively affect the health of those who are receiving Medicare. Mr. President, when you hear rumors about how reform will affect seniors, consider the source. Just listen to some of the inflammatory quotes. A Republican member of the House of Representatives said, "Let me tell you here and now, it's socialized medicine." Another Republican congressman said, "We cannot stand idly by now as the nation is urged to embark on an ill-conceived adventure in government medicine, the end of which no one can see, and from which the patient is certain to be the ultimate sufferer." Well, Mr. President, those are not quotes about the current health insurance reform effort. Those statements were made in 1965, when Republicans were opposing the establishment of Medicare, and their position has not changed. Republicans have voted against Medicare almost 60 times in the last 10 years, and now all of a sudden Republicans are claiming that Democrats support cutting Medicare benefits? Well, Mr. President, that's why last Sunday the New York Times said that Republicans are, quote, obscuring and twisting the facts and spreading unwarranted fear. Scoring cheap political points doesn't do anything at all to help Americans get affordable health insurance. Our families, and especially our seniors, deserve better. You don't have to go back too far to find a perfect example of this Senate's history on that subject. Just last year, Democrats overcame a Republican filibuster and a veto by then-President Bush to pass the Medicare Improvements for Patients and Providers Act. That bill prevented physicians from suffering cuts in the rate at which Medicare reimburses them for providing care to seniors. If those cuts had happened, many doctors would have been forced to stop treating patients with Medicare, severely limiting seniors' access to health care. Democrats wanted to make sure there were enough doctors to go around, and we did. That bill also made common sense fixes to Medicare, including requiring that Medicare cover cardiac and pulmonary rehabilitation programs, lowering seniors' co-payments for mental health services, and preventing cuts to vital oxygen equipment and wheelchairs. Though that bill should not have been controversial, it was vetoed by President Bush. And when the Senate had a chance to pass the bill over that veto, it was only Republicans, almost 60% of those in the Senate, who sided with President Bush and said no to our seniors. Well, actions speak louder than words, so don't be fooled when Republicans tell you that Democrats don't want to protect Medicare or that health insurance reform won't be good for seniors. The truth, Mr. President, is that the Democratic proposal will help our seniors get the care and coverage they need and have earned. This should come as no surprise to anyone. After all, Democrats have had a long history of working to improve the health and general well-being of seniors. Democrats created Medicare over the objections of Republicans because we recognize that no American should go without health care, especially once they reach retirement age. And the American people know it has been Democrats who've been protecting Medicare for seniors since we created the program 44 years ago. And nothing has changed. Today, it is still Democrats who are fighting for better, more affordable health care for everyone, especially our seniors. So specifically, our plan moves towards closing that donut hole in prescription drug coverage and providing access to more affordable generic drugs. If you have Medicare, our plan makes recommended preventive services like colonoscopies and mammograms free. It will ensure that if you have Medicare, you get a free physical every year, not just when you enroll in the program. And our plan will aggressively attack the fraud and abuse that raises Medicare costs for seniors and for all of us as taxpayers. Mr. President, one thing that has been too often missing from this discussion is what will happen to Medicare if there is no reform. It is now projected that as early as 2017, if we do not make changes, the money Medicare spends on benefits and services will be greater than its income. At that point, seniors would have to pay a greater portion of their health care costs or receive fewer Medicare benefits. That's unacceptable. Our current system is unsustainable. And that is one of the reasons that nonpartisan AARP supports reform this year. They know, like we do, that we must protect Medicare for our seniors over both the short term and the long term. And our plan will prevent cost increases and overpayments to insurance companies in order to keep Medicare out of the red. Mr. President, now is the time to act on health care. And let me be clear, under the Republicans' plan, insurance companies can dump you for a pre-existing condition because you're a woman, because you're getting older, because you get sick, and Medicare will face bankruptcy. Under our plan, if you like what you have, you keep it. If you don't, we're going to provide affordable choices for you. We are going to protect Medicare. We will not raise taxes on the middle class, and we will not add a dime to the deficit. Mr. President, every day, 14,000 more Americans lose their health insurance. That has to stop. But this is not just about those who don't have coverage. The cost of treatment for the uninsured is passed on to every taxpayer. It's estimated that a family of 4 pays a hidden tax of $1,000 every year in premiums to help pay for those who don't have coverage. So we will help remove that burden from all of our working families. We will provide stability and choice to our families and to our businesses. We will return healthcare decisions back where they belong, in the hands of patients, doctors, not insurance company but bureaucrats. And rumors and misinformation and scare tactics about Medicare should not prevent us from passing meaningful health insurance reform legislation this year.